for that kind of thing, just to make it more interesting, okay? All right, so first thing we're going to do is this here, and then if we have time permitted, I have something else planned afterward, and then also if you have any kind of questions, you can always ask. How many of you guys actually did the study guide? Hey, look at that, that's pretty good. All right, we'll go over that too at the very end if we have time and stuff like that, so you guys have an idea of what you should be studying for Monday's exam, okay? So once everybody gets in, we can get started. All right, Caleb, what do you want? So the categories are safety, infection, there's wounds, rhyme time. Okay, with rhyme time, there's a twist. Your answers must rhyme. Okay, so it's a little tricky. There's nursing treatments, and then I also threw in labs because you guys got to start understanding labs for, it's going to keep building and stuff like that. I'm not testing you on labs this exam, but it's just something for you guys to, get in the habit. So Caleb, what do you want to do?
Safety 200.
All right, safety for 200. Oh, there is also a daily double hidden somewhere in here as well.
What does that mean?
You never watched Jeopardy? Oh my god. All right, Jeopardy. Oh my god. All right, daily doubles. If you land on a daily double, that means that you can double your score or wager whatever amount you want to wager. So right now, say Caleb hits a daily double, he can wager a total of 1,000 points. Okay. But as you keep going on, you can double whatever supports you have and stuff like that and try and win the game. Okay. All right. What'd you say? Infection for 2? Safety for 2. Okay. It's on your phones too. Whoever knows, they can buzz in. Whoever potato is, what is it? All right, cherry red, unconscious, convulsion, so you go into seizures, even death. Maybe you should have bought this detector, carbon monoxide poisoning. Okay, so regarding this here, so we're looking at the safety in the home environment. Okay, what are other things you might want to consider when it comes to safety in these different environments, different populations, and that kind of thing? What kind of education do you want to focus on? What's that?
Fire safety.
Fire safety. Okay. What else? Falls. So how do we prevent falls in the house? So clear walkways. No rugs. Adequate lighting. Everything within range. Airlift. Okay, that'd be a good one. What's that? Make sure everything's on one floor. Try and have everything where everything is accessible. They don't have to climb upstairs or to go down in the basement, that kind of thing. Okay? What's the answer? Unlike measles, TB, or chickenpox, influenza is spread by this method. What is airborne? That is correct. I'm sorry, no, that is incorrect. How is the flu spread? Droplet precautions. Okay. So droplet. All right. So when it comes to droplet precautions, what kind of PPE do you have to wear? Mask, face shield. Whoa. All right. Mask, face shield, those are all good things. Gloves, minimum. Okay. What about airborne? Negative pressure room. N95 gown. What else? So you have the N95. So spacesuit that kind of gives a pack of mask if you're not fit tested for the N95. Okay. Gown as well, gloves too. What about contact? Gloves and gown. Okay. Granted, before COVID all hit, it was just gloves and gown. Now that since COVID's here, we have to wear the mask and stuff like that. But that's not part of the standard rule with contact precautions. So The question was if you wear glasses and stuff like that. As long as you have the side coverings, you're fine. Okay. Regardless, you need some kind of eye protection when it comes to that there. Okay. All right. Someone else pick. Paige, what do you want? Wounds for 4. Whoever tomato is. So this tan green color fluid is expelled from a client's abdominal wound. So what is this fluid? That is correct. What is purulent discharge? Okay. So what are the other types of different drainage that you can see? So what does serous look like? Watery, yellowy, kind of like beer looking, kind of to a degree. What else? Serous sang. So serous sang is a mixture of serous and sanguinous. So what kind of color can you expect to see? Pinkish, maybe even a clearish color, but it's more pink. Okay. What else? Sanguinous is? Okay, red. So if it's fresh sanguinous or fresh blood, what's it going to look like? Bright red. And if it's old, dark. Okay. Anything else? Purulent. So if you put it together, what does it sound like? So bloody pus. Okay. All right. Good. All right. Tomato. Where do you want to go next?
Wounds 500.
Wounds for 5. Giraffe.
Secondary.
Secondary. Why?
Because you can't close it up like sutures.
And how do you want it to heal?
With granulation.
Granulation tissue. So good. You want this thing to heal from the inside out. Okay. Primary. What does primary look like?
An incision that you can close like via sutures.
So primary intention, it requires us to manually close it. Okay. The ways that we can do it are by which ways? Sutures, staples, glue, little tape thing. So steri strips are another option. Okay. So that's primary. Secondary, it's going to heal from the inside out. Okay. So we want that good granulation tissue to form, and we're going to do whatever we can to help promote that growth. Okay. Whoever got that. All right, where do we go next?
Wounds for 300.
Dolphin. No, it's not exudate. Lobster. It is the lobster. What is dehiscence? That is correct. Okay. So with dehiscence, what happens is, say you have a suture or you have some kind of incision. You can either have a lot of swelling, you can have infection, or you can even have foreign bodies still remaining in that area. But what happened is what? The different layers are going to spread apart, okay? That's the dehiscence. Usually it's from a lot of swelling and that sort of thing. So if this happens with a patient, what are you going to do? You can put a binder on it, help secure it.
Lay them like down, their knees up.
So you want them at least maybe 20 degrees, their head of the bed with their knees flexed. It's going to take some pressure off their abdomen so you don't lead into what's the bigger problem that can occur. Evisceration. So that's whenever their bowel is hanging outside or whatever tissue or muscle or organ is hanging outside the body. Okay? Lab for 100. Giraffe. What is white blood cells? That is very good. So with infection and stuff like that, you will see potentially an increase in white blood cells. What is the normal range for white blood cells? 5 to 10,000. Okay, good. Now there's different classifications of white blood cells, which you guys have known and gone over with your lab cards and stuff like that. So there's neutrophils. Those are your first line of defense. There are your lymphocytes, which are your immune cells. There's monocytes. That's your second line of defense. Eosinophils and basophils, they look at your allergic responses and stuff like that. Okay? Okay, where do you want to go next?
Miscellaneous for 300.
Dolphin. No one is glucose. Meerkat. Who's meerkat? Red blood cells. That is correct. So I'll either take red blood cells or H&H and stuff like that because you have to look at your H&Hs when it comes to blood volume too. They give you a really good accurate index when it comes to that. Now, pertaining to wounds and stuff like that, we have to be looking at bleeding and that sort of thing. So there's either internal or external hemorrhage. What are some obvious signs of either one? Elevated pulse. Okay, you can see that. What else? Low blood pressure. Why would you see a low blood pressure when you're bleeding? Less volume. You're losing circulating volume, so it's either going outside the body or it's going somewhere inside the body. Okay. If it's really bad, you might start having organ involvement. Okay. You might start losing consciousness. You might start having some chest pains, breath. Those are very common things that happen whenever someone is actively bleeding. That can happen with some different wounds. So whenever we're looking at bleeding, we have to be able to see how can we stop this thing. So whether if it's applying pressure or applying a tourniquet, okay, or restoring blood volume by giving different blood products as well. Okay, where are we going next? Labs for 5. Dolphin. What is potassium? That is correct. Someone knows their labs. Okay, so again, these are just here to help you guys because, or just to test you because this is stuff that you're going to be able to be seeing in the very, very near future, like next week. Okay, where do we go next? Wounds for 100. Giraffe. Primary intention, that's correct. Okay, where are you going next? We already talked about that one there.
Labs for 400.
Bruce. Who's Bruce?
Anemia?
Not anemia. Dolphin. Oh, crab. Sorry, Mr. Krabs. What's the word for it? You have low platelets. Thrombocytopenia? That is correct. Thrombocytopenia. So that's something else that you have to watch out for there. If you have low platelets, you're going to bleed out a lot. Okay, go ahead again. Safety for 3. Crab. That is correct. What is falls? So going back to what we said earlier, preventing falls, say in the hospital and stuff like that, what are very important things you need to do so that your patient does not fall? All right, I hear bed alarm. Raise your hand so I hear what you're saying. Yellow socks. Yellow armband, yellow star. Bed alarms, chair alarms, that kind of thing.
Hourly checks.
Hourly checks, that's a very important thing. So when it comes to hourly checks, what do we have to do during hourly checks? What are you checking for? I heard bathroom. Call bells in reach. If you need to, okay, you can always move them to closer to the nurse's station. Pain assessment. If they need any kind of nutrition, that kind of sort of thing. So that's what all your should include. Yeah, what else do you have? Repositioning is the other thing as well. Are they comfortable and whatnot? Okay. Big thing as well. What assessment can we do? What kind of numbers do we use? What's that called? Hester Davis.
Sorry.
Okay. So we said with the Braden scale, you want your scores to be on the higher side. Hester Davis, you... Okay. Crab, you can go next. Infection for 5. Potato. Protective isolation, that is correct. Does anyone know what the other names are for it? Neutropenia precautions, and there's one more. Reverse isolation, that is correct. So, who are these people who have low white blood cells? Cancers? Who else? HIV? Anyone else? Anyone's immunocompromised, okay, if they're on the chemotherapy agents, if you have HIV, that kind of thing, okay? So, how do you differ between the different stages? So, stage 1, this would be an area that is unblanchable, is reddened, okay? What's a stage 2? So, we have lost the first covering of the layer of skin, so we're through the epidermis, and now we make contact with the dermis, okay? What about stage 3? What does a stage 3 look like? So you might have slough. You're into subcutaneous tissues, okay? What about stage 4? Okay, so you're into the bone, you see some muscles, you see some tendons, okay? At this point, you might see a lot of slough, maybe even some eschar, in regarding to that there. What is unstageable? So, unstageable wounds, what they will have is you have a layer of eschar on top, okay? And what you can't do is you can't determine what's underneath it until it falls off. Whether if it falls off naturally, or if we manually take it off, whether we debride it, or go to the OR and it gets removed in that environment down there, okay? Usually we have a stage 3 or stage 4 that's underneath those types of pressure injuries, okay? What is a deep injury, deep tissue injury? So it looks like a really bad bruise, okay? You have injury down into the tissues, but you haven't had any break in the tissues. Like I said, it looks like a really, really bad bruise. All right, where do we go next?